Welcome to Prepared Tennessee LTC, a podcast created to provide resources and information on the current topics experienced within Tennessee long-term care and skilled nursing communities. I'm your host, Rachel Turner, an Associate Program Manager here at Vanderbilt University Medical Center's Program and Disaster Research and Training. In this episode, Dr. John Walsh, a co-director at Vanderbilt University Medical Center's Program and Disaster Research and Training, will be speaking with Dr. Russell Peterson, a retired division chief and emergency management and continuity program manager. In this podcast series, facilities will learn what to do in the event of a tornado or severe weather. You are listening to the conclusion of a 3-part series.
Thank you, Russell, for meeting again with us so we can discuss briefly about tornado preparedness. But what can a facility do, or what can they expect if say they have some damage to their facility as a result of maybe tornado or severe winds or things of that nature? What kind of services will be provided to them, and what agency will they generally be in contact with if, say, they need help during those types of situations where their facility is either partially damaged or severely damaged?
That's a great question. I think it's important for everybody to understand that during the emergency services are going to be very busy. And so it kind of reiterates some of our previously discussed recommendations about making contact with your local emergency management agency or your local fire department, just so they know that you're there. And so typically your emergency management agency or your fire department they're going to have a pre-plan for your facility. Most often they're going to reach out to those vulnerable populations to make sure that you're getting everything that you need to be able to continue operations. Emergency managers understand how hard it is to evacuate people out of long-term care facilities. And so typically emergency management agencies will do what they can to keep you in the facility so that you don't have to evacuate. And evacuation is really kind of a last resort, just because of the amount of work that it takes, and particularly during a disaster where the staffing is at a premium as it is, and they're working 12-hour shifts. This is really hard to evacuate. You should really expect, it's kind of a mixed bag. I highly recommend having a really robust continuity plan so that you've taken on that role of securing contractors to keep you running. It's really difficult on emergency management agencies when they start getting a lot of requests for resources to keep facilities open, because you're competing with all these other emergency management organizations on limited resources. So I always encourage facilities to have a very robust continuity plan, have a list of resources that you can reach out to that can help you stay open. And so that could be, maybe generator repair companies, it could be electricians, it could be plumbers, it could be general contractors, whatever you need to stay open. Now, in the event that you do experience some loss, there will be representatives from your local municipality or your emergency management organization that'll be out assessing the damage and working into the recovery operations. But I wouldn't want to rely on anything other than yourself to make sure that you can remain operational.
One thing, Russell, we've talked about tornadoes for the last several sessions, but with tornadoes, a lot of times you get increased rainfall. And we've seen, historically, over the last few years, how rainfall in Tennessee is increasing. So there's a lot of flooding in areas that may not have been flooded before. We talk about the 100-year floodplains and things of that nature. But those incidents are becoming more increasing as time goes on. And so, flooding is a real problem. What could you tell the staff, say, if they're caught in a situation where there's, flooding and they're coming into the facility or leaving the facility, they have water running over the roadways and things of this nature. So what can they do in those types of situations?
Once again, planning for those scenarios is so important. And being weather aware is super important. If you're in a facility that's in a vulnerable area, you definitely want to have plans to be able to get people out of a facility. And so that would be one of those instances where, from an emergency management perspective, flooding and hazardous material are those two emergencies where we would want to evacuate people out of a facility, and obviously fire if you don't have a sprinkler system. But I would definitely want to have a robust evacuation plan, and the second half of the robust evacuation plan is first half of having some way to get people out of the facility. But equally important is having some place to take these people to. And so a lot of times, facilities, they may not have a location, a shelter to take the residents to. And then, by reaching out to your emergency management agency to verify that shelter is not being used by somebody else. There's a lot of times where you've identified a shelter and somebody else has identified that exact same shelter. And then when the event occurs, then you find that both of you are competing for the same shelter. And so you would definitely want to make sure that shelter is not double booked, in essence.
Another thing, because we're dealing with disasters, so to speak, resources are going to be limited. Your healthcare coalitions, every region in the state has a healthcare coalition. And I would advise you to get involved in that group as well, because they offer a lot of healthcare related resources that would be beneficial to long-term care and skilled nursing facilities during these types of events. So that's just one recommendation that I think would be very beneficial to your overall emergency preparedness planning. Another thing, very briefly, Russell, if one of the staff members is driving into work or driving from work during one of these flooding events and they see water on a roadway, we've seen those videos and movies where a person is either trapped in their vehicle or their vehicle's floating down a river or something of that nature. So what do you recommend if they possibly run into those types of situations during the flooding?
Most definitely, I recommend in the National Weather Service is really good about getting this out, and it's their phrase "turn around, don't drown." I think one of the biggest misnomers when people see water across a road is that that water is not that deep, so I can drive across it. The problem is that one, it doesn't take much water to remove a vehicle from a roadway, just based on the power of running water. The second part of it is that you don't know whether or not the roadway has been washed out. And so you may get out on a piece of roadway and then drive into the piece of roadway that's been washed out. And now your car is basically sinking into this large kind of a hole that's been made by the running water, and then you're being washed down the creek or the river. And so we definitely reiterate what the National Weather Service advises about turn around, don't drown. And it's just nothing that's worth trying to risk driving through a road that's covered up with water.
One of the statistics that I think is pretty telling is that of all the deaths that are related to flooding, the activity of the victim is driving. So they drive into these areas or drive over roads and then all of a sudden get washed out. But that's the number one cause in death in flooding of an activity. So it's something that we would encourage each of you not to do. And even if you're going to be late for work or late for going home, you don't need to chance that. So, well, Russell, we appreciate your time on this, and thank you for your thoughts and your information.
Thank you.
Our pleasure.
If you have questions regarding anything that was mentioned in today's podcast or would like to learn more, please visit our website at www.emergencyltc.org.